Hello everyone, my name is Marissa Hubble and I am an Indiana State University nursing student. Today I will be doing a presentation on immobile clients, such as wheelchair-bound or bed-bound individuals and associated skin risks. This specific population may include elderly or older adults or developmentally disabled members of the community. So the focus today will begin with educating you on skin changes throughout the lifetime, potential risks and causes of skin breakdown, including prevention techniques, and appropriate care to consider if an opening or problem area develops. In addition to this video, I also have attached a PowerPoint presentation to print out as an educational handout. I will also have it in the background as a reference, but since it can be difficult to see in the video, it's nice to have that hard copy in hand. We'll move through the educational portion of this presentation, and then I will move into more of a interactive role to kind of demonstrate the type of things that we have learned and be a better visual cue for those type of learners. So quickly, the learning objectives for this presentation. The hope is that you can recognize how fragile skin can be and be conscious of this when interacting with clients. Understand the importance and the frequency of skin assessments and checks, as well as the frequency of position changes to allow for pressure relief. It's also the hope to be able to identify reportable skin issues early so there can be early intervention, provide appropriate care to promote healing, and implement interventions to prevent reoccurrence. The next slide is a 10-question test about this specific population and skin risks. You can take it in the beginning just to try and get a baseline of where your knowledge is at with this population, and then hopefully by the end you're able to answer all of these questions and gain a better understanding. So the first topic we will briefly go over is skin changes with aging. It's important to note that at the bottom of these slides there is a URL link that you can go to these websites to learn more in-depth information about these specific topics. So as we age, we notice that our skin becomes more thin. There's a reduction in strength. The blood vessels become more fragile. You may notice they are more prone to bruising. The decrease in oil production results in dry skin. And then the fatty layer becomes thinner and there's less padding and insulation. So the accumulation of all of these different changes that we see puts individuals at risk for injury that you're more likely to see than in someone who, a younger adult. So our next area that we will talk about is the two areas of concern that we're going to focus on today. So for those who are wheelchair bound or bed bound, you may notice that there's also an incontinence issue. And so specifically incontinence of urine, there is a risk, as you can see in the picture on the left here, of kind of a dermatitis reaction. So that happens when that moisture is stuck up against the skin for an extended period of time. It causes that redness, inflammation, and irritation. So it's important to, in these situations, that you're changing the brief as needed. So if there's, if they were able to urinate, you want to make sure that that urine's not sitting up there too long and could cause this issue. This could be done with implementing a toileting schedule, so you can set times throughout the day that you're changing that brief so that you're ensuring that this isn't going to develop. And also considering applying a barrier cream. And sometimes these are prescribed by the doctor, but that barrier cream just creates a nice film on the skin so that that moisture isn't sitting directly up against it. And the other area, major area to consider is the pressure points. So we think of the bony areas on the body, and most people originally think of the buttock area, but it's also important to consider the elbows and heels as well. So the diagram here just shows the different stages of pressure ulcers. The important one is stage 1, especially for somebody who doesn't have any open areas at this time. And that's non-blanchable erythema. So what that means is that when you press down on the skin and you release, you'll see a white circle and then it quickly turns back to pink. Well, when you press down on these red areas and you don't see that pink at all, that's considered non-blanchable, and this is the first sign of a pressure ulcer developing. So it's important to immediately implement pressure relief there. And then the things about stage 2, 3, and 4, just to show how pressure ulcers can develop and the problems that can occur, including infection. So it's important to offload, which we will demonstrate here later in the video, with pillows, and then implement a turning schedule every 2 hours because the pressure ulcer can develop within that time. So it's important to follow that schedule throughout the day. Again, there's a URL link at the bottom if you would like to learn more about these topics. And so the other things to consider, in addition to those two major areas of concerns, is nutrition. And good nutrition is needed to help any type of wound development. And most importantly, protein intake. It's an important nutrient to help with healing. Diabetes, you may notice that high blood sugars will affect healing time, so it's important to make sure that the blood sugars are under control, as well as a well-controlled diabetic diet. Smoking cessation is always important to encourage, and especially in the event of healing wounds if they are developed, because that can impede healing time. And then, of course, with decreased or impaired immunity, their immunity's down, they're going to have less antibodies in their system to help fight any infection or any disease process that may starting to be developed. So then we move on to the prevention. So the prevent. We want to make sure that this population does not develop any of these risks of skin breakdown, whether it be incontinence, pressure, ulcers, or etc. So we want to do frequent skin checks. These individuals may not be able to perform skin checks themselves, depending on their disease process. So it's important that we are laying eyes on the whole body as frequently as possible. Pressure relief, which again we will demonstrate in a moment, just keeps the allows you to reposition the client so that they're not stuck in one position for too long. And then careful transfers. As we were discussing earlier, the skin becomes more fragile as we age, and so even something as simple as sliding a patient up in bed can create a skin issue for that client. And so it's important that we avoid any shearing or anything that can happen, and just be very aware of the risks of skin injury. And then back to incontinence, we want to change the brief as needed, so you don't want that moisture sitting up against the skin for too long. So that's just a brief rundown of the educational portion. Again, you can go to these websites to get more in-depth education about these topics, and I'm going to now move into the more interactive role to kind of demonstrate what I mean by pressure relief. So I'm going to turn the camera here. I've got my lovely mannequin, if you can see him, that I will use to demonstrate. So right now he's in a sitting position. I'm going to grab some pillows and just show, for example, for someone who might be in a wheelchair, a way to relieve some pressure is just kind of help, whether they have a special cushion in their chair, which is also important, but you can also work on kind of turning them and tucking a pillow under one side and helping them roll on that side. And then every 2 hours changing them, so then you can roll them onto the left side and they'll push a pillow under the right buttock just to help relieve pressure. And then also for individuals who are bedbound, we can lay him back. Lift up his feet here. And if we want to use the term floating here, make a view for you. You can place a pillow under the calves so that the heels are not pressing up against the bed. You can see there's floating here, there's nothing underneath them. So that's just an example of floating, so that we don't develop any pressure ulcers in our heel areas. And this can be also true for anybody who is at risk for breakdowns on their elbows if they're bedbound as well. So we can help float those elbows. And then the same is true for these bedbound individuals for pressure relief by, if they're laying flat, again, we can roll them on their side and tuck that pillow under their left side to give that some relief, and then change that again in 2 hours for the right side. So these are just some examples of what you can do to relieve pressure. Again, it's just important to remember to follow that schedule, and any individual in this specific population can be at risk for skin breakdown. So just important to consider all of these things. I thank you very much for your time, and I hope that you have learned something in today's presentation. Thank you.